Lisa Broyles here with Way to Health MD, and this is a 2-video series, mini-series I guess, about the newest GLP agonist. So we've all heard of Ozempic, we've all heard of Mounjaro, which is tirzepatide, but there is a new third drug in the pipeline by Eli Lilly, and it is called Retatrutide. In this video about what the research says, what the studies are saying, what this drug can actually do. And in the second video, we'll talk about the dangers of it and what you can do to try to mitigate that if you find that you need to be on this medication. So first of all, I want to say that Retatrutide it's hard to say that word, has not been FDA approved. It is in phase 3 clinical trials. This means it's in human studies right now. Okay, so this drug is not available yet except as a research-only peptide. So some compounding pharmacies are making it and selling it, but it is not yet FDA approved because the studies aren't complete. So basically what we know right now is that there are these TRIUMPH trials that are being done by Eli Lilly across 14 countries, 5,800 people in these studies. Okay, so what they are doing is they are doing a 4 milligram, a 9 milligram, and a 12 milligram dose of Retatrutide in escalating doses to get to that 9 to 12 milligram dose, and they're looking at patients that are obese and also have either obstructive sleep apnea, osteoarthritis of the knees, or cardiovascular disease. So there's multiple studies going on looking at different endpoints and what the weight loss of the drug does to these different endpoints, okay? I will start by saying what these studies have found, and this is exploding across the medical community, and you're probably hearing about it because the doses of 9 to 12 milligrams are causing anywhere from 24 to 27% weight loss over 48 weeks. This is a massive amount of weight loss. So they're finding that people that reached a plateau on Ozempic or Mounjaro on this drug are easily breaking through that with faster weight loss, and not just weight loss, but they are losing their intra-organ fat, okay, the fat in the liver. So we are now estimating that 1 in 3 people in the United States have some level of fat infiltrating the liver. This is from what we call metabolic syndrome. It's from us Americans having too much food, not enough exercise. Okay, the fat accumulates in the liver, eventually causes scarring and permanent liver damage. So this is called non-alcoholic steatosis, NASH syndrome, metabolic fatty liver, non-alcohol. If you have fat in the liver, this is a drug that can literally melt that fat. It increases something called thermogenesis, okay? That 14% of the people on the 9 milligram dose of Retatrutide completely resolved their knee pain, gone because of their weight loss. Those knees aren't carrying around so much weight, they don't hurt as much. They saw a decrease in apneic events in obstructive sleep apnea. They saw a reduction in cholesterol levels, HSCRP, which is inflammation in the heart arteries, decrease in blood pressure by as much as 14 points systolic on the 12 milligram dose. So you're seeing major improvements in people's health after 48 weeks on this drug. So how does it work? So Ozempic enhances the GLP receptor. I've covered this in other videos. Tirzepatide covers the GLP and the GIP, which blocks the nausea that commonly occurs with the first drug, Ozempic, okay? So that's why tirzepatide is more easily tolerated than Ozempic or semaglutide. However, this third drug also stimulates the glucagon receptor. Now, typically, glucagon has been seen as the villain in weight loss treatments because it tells the liver release blood sugar. So typically, we don't want glucagon because it's the opposite of insulin. However, scientists discovered that when you stimulate GLP, GIP, and glucagon receptors all at the same time, you get thermogenesis. This is literally what it sounds like. It revs up the heat, okay, and it literally melts intra-abdominal fat in glucagon receptor at the same time as the other receptors, and it does this by enhancing the mitochondria, which we've talked about before. Those are your energy cells. It turns up turns on the gas. It makes those mitochondria work extra hard to produce energy to melt fat. Okay, the one problem here is that it melts fat, but you're also melting muscle. So that's what we're going to talk about in video 2, is how can we prevent muscle loss. So it works by stimulating those 3 receptors. You're burning fat at an incredible rate. Your body is literally sitting still, but burning the energy of running a half marathon on this drug. Increased heart rate, possibly increased flat affect or lowered mood due to lowered dopamine production, and muscle breakdown. So stay tuned for video 2 and we'll talk about what we can do about that.